In recent times, we've heard of young people in their 20s get heart attacks. Really fit people who exercised very, very regularly have suddenly collapsed one day and died. So, does this mean that if you're young or if you exercise regularly, you are free of any risk from developing a disease? No. And even if we have to talk about diabetes, in the last 5 years in India, it has increased by a good 40%. And mind you, these are only those numbers which actually got tested. So the real number is very likely much more. But what do we do about this? Is there a way to actually identify a risk well in advance and prevent all of this? Yes, there is, by doing the right kind of tests. So a lot of us are doing our blood tests regularly, but what is happening is we are not being recommended, unfortunately, the right kind of tests. So these tests, they help us understand our risk of disease like diabetes and heart disease well in advance, a good 10 years in advance. So two such tests are fasting insulin and homocysteine. And mind you, the numbers that you see on your reports may not, even if the lab range says it's normal, it may not necessarily, mean that you don't have any risk. So doing the test is important, but going to someone who is an expert with this, who can analyze those reports properly and give you specific changes in your diet and lifestyle in order to minimize that risk is very, very important.